Hello, good morning, namaste, and a very warm welcome to the Health Conclave 2023. Without much ado, I'd like to invite the dignitaries onto the dais. I request Mrs. D. Anitha Garu, Director Operations, KIMS Hospitals, to kindly come onto the dais. Can we have a round of applause? I would like to now invite Dr. Durga G. Rao Garu, Founder and Medical Director, Oasis Fertility, to kindly come onto the dais. I would like to now invite Dr. Bolneni Bhaskar Rao Garu, Chairman and Managing Director, KIMS Group of Hospitals, to kindly come onto the dais. I now request Dr. K. Shilpi Reddy Garu, Clinical Director, Obstetrician and Gynaecologist, KIMS Cuddles, to kindly come onto the dais. May I now invite Dr. C. Aparna, Clinical Director and Senior Consultant, Neonatology, Pediatrics, KIMS Cuddles, to kindly come onto the dais. I would like to now invite Dr. Janaki Yalamanchili, Consultant Dermatologist and Cosmetologist, to kindly come onto the dais. I request Dr. Shilpi Reddy Garu to deliver the welcome address.
Good morning, one and all. I know Sunday afternoons are very, very important for everybody. Thank you so much for joining our initiative, the Women's Health Conclave, which is the need of the hour, and it is one of the important aspects of every woman's life to take care of her health. But one way or the other, there is one part of her negligence that is happening, and women are on the second line in terms of healthcare. Here at Women's Health Conclave, we wanted to talk exclusively about women's health and how can we make that smaller change in the society to improve women's health. And women's health not only means physical health, it also means her mental well-being also. And today we have various specialists and leaders in their arena, where some of them are promoters of women's health in terms of the KIMS Group of Hospital, which is one of the largest chain. And we here are trying to make that difference that we can get into every woman's life out there. And we have exclusive empowered women who in their specialty are trying to make that difference. Women's Health Conclave, here we've given an opportunity to every woman who's attending this conclave, who are representing their own organizations, whether it is a corporate or whether it is an insurance company or whether it is a woman entrepreneur who's coming for the conclave. They themselves can ask their opinion and they themselves can reflect their doubts and choices and ask the specialists here what they really want as a process of the changes that we're expecting in women's health. And in the current scenario, women are the driving force behind so many organizations. Here at KIMS also we have every department, there are women who take care of the entire department, like what women take care at the house, we are also there taking care of the organization. And as a part and parcel of the process, we encountered several problems in terms of their health, well-being, and their wellness. So that's why this Women's Conclave, we wanted to talk about women's health and make sure that we have one small change that we really want to get into the society. Thank you.
Thank you, Doctor. Now I'd like to request Anitha Madam to kindly speak a few words. Good morning to all the successful women here. Good morning to our dignitaries present on the stage. I stand before you today at Women's Health Conclave with a powerful message, stronger and healthier together. We have gathered here to discuss, educate and empower ourselves about the critical issues of women's health. It's a cause close to my heart. First and foremost, let us recognize the immense strength and resilience that lies within every woman. Women face a lot of challenges. Despite of all adversities, women have arisen above and beyond. However, despite remarkable achievements, the journey towards women's health remains ongoing battle. Women today around the world continue to face unique challenges which needs immediate attention, from reproductive health to mental well-being. Let us begin to acknowledge the importance of comprehensive healthcare services tailored specifically for women. Access to quality health care is not only a fundamental right, but a critical component in women's empowerment. We need to prioritize preventive care and well-being. Corporate hospitals typically have a multidisciplinary approach towards women specifically tailored for women's health, which ensures comprehensive and coordinated management. Let us together achieve much more than we could have done alone. We can create prioritize women's health. Our experts on the dais will give more insights on how to take it forward. Thank you. Thank you very much, ma'am. Now I'd like to request Dr. Aparna Garu to speak a few words. Can I request a PowerPoint, please? A very good morning to all the dignitaries on the dais and to the respected members of the audience. I represent the Department of Neonatology and Pediatrics from KIMS Cuddles, and we are very, very glad to have all of you present on this illuminous occasion. So, we all know that significant and long-lasting health benefits accrue from investing in health, quality of life, productivity, as well as economic growth of women as well as children. Despite these benefits, despite all these benefits, we still know that there are glaring gender gaps which are to be filled if we have to reduce neonatal and infant mortality rate, under 5 mortality rate among children, to provide equitable access to quality health care among both women and children, and to improve outcomes for children not only under 5 but also those children surviving past the age of 5 years. Because healthy women and children are the linchpin for a healthy society and thriving societies, we all know that investing in health access for women and children is indispensable for all countries to achieve the new sustainable developmental goals that are laid down by the World Health Organization. In low and middle income countries, providing more education for children, especially girls, can result in greater accumulation of human capital, increased productivity, increased income, and increased economic development as well as sustainability. I hope the slides are visible. Can anyone confirm?
So it has been well documented that investing in the health and quality of healthcare towards women has resulted in better healthcare seeking behavior, not only amongst women, but mothers are able to provide this for their children. It has been found to benefit families. It is seen that women invest 90% of their monthly income towards the health, towards the development of the family, in comparison to 30 to 40% of the monthly income of a man. So it is directly shown that empowering women, providing better employment opportunities can benefit families. It also increases productivity. Eliminating barriers, gender barriers for employment for girls and women has been found to improve labor productivity by close to 25%. Not only this, investing in women's health and education strengthens economies. When 10% more girls go to school, it has been seen that the country's GDP can grow up by almost 3%. Not only this, growing evidence show that corporations and companies, businesses that are led by women are more focused on sustainability. So with all these insights, it is indispensable that as a country, as a community, we invest towards empowering women towards better health attention, education and employment. And with a special context of neonatology and pediatrics, I would like to say that today in India, which is one of the biggest populations in the whole world, especially with a large number of newborns and children, we have 27 million newborns that are delivered in our country every year. And we also have the dubious, notorious distinction of having the highest number of neonatal deaths every year. So the role of the woman, the role of the mother in reducing the morbidities as well as improving quality of survival among the newborn cannot be underestimated. I hope the slide on the mortality rate is visible now. Yes. So I hope you can appreciate that with every passing year, the neonatal mortality rate is now coming down, and as we speak today, it is at close to 20 deaths per every 1,000 live births. So the role of the mother in safeguarding the health of the newborn is definitely something that cannot be overemphasized. Coming to the role of KIMS Cuddles as an organization, as a custodian for safe maternal and newborn health, we are very happy and privileged to say that we are endowed with dedicated state-of-the-art NICU and PICU with qualified super specialists around the clock, and not only providing quality care, as an organization we believe in compassionate and family-centered care. And with this, we have been able to achieve exemplary and world-class outcomes that are comparable with the world standards. So we have 24/7 emergency services and well-equipped state-of-the-art ICUs, neonatal, pediatric, maternal medical ICUs, cardiac ICUs, super specialty backup that is present round-the-clock transport, ambulance services to provide services to our outreach hospitals where we cater to a large number of extramural or outborn newborns, round-the-clock coverage for maternity homes around the hospital, and sometimes even for non-local transports with state-of-the-art laboratory services. We are glad to say that we have been able to expand our scope of neonatal services to extremely preterm newborns from 24 to 25 weeks of gestational age, very low birth weight neonates starting from 500 grams birth weight, neonates with severe respiratory issues, hemodynamic issues, complex congenital heart disease, birth defects requiring pediatric or cardiac surgeries, neonates requiring conventional and high frequency ventilation, CPAP, high flow nasal cannula, peritoneal dialysis, etc. We are able to achieve the highest possible quality of care by believing in rigorous protocols, standardized implementation policies across the units. We have bundles of care for taking care of standard procedures such as prevention of ventilator-associated infections, central line associated infections, and regular processes, checklists for various processes and audits in place so that we ensure that quality of care is sustained throughout our care. We also have unique expertise with pediatric cardiac surgical services, and we have been able to extend cardiac surgical and interventional cardiac procedures for close to 50 newborns who have been delivered with serious critical congenital heart defects with more than 95% survival. These are babies who require not only advanced expertise but also advanced infrastructure that includes a heart-lung machine for undertaking cardiopulmonary bypass, and expertise in undertaking central lines, arterial lines, invasive blood pressure monitoring, and lots of other advanced monitoring that is required for being able to provide the rigorous care that these babies require. And we are also proud to say that we have a hospital-based infection control program to make sure that in the process of delivering this degree of advanced care, we do no harm to our babies. So there is a rigorous protocol for quality improvement, which includes data collection, that includes reducing antimicrobial resistance and sustenance of all these gains. While doing all this, we also remember that the role of the mother cannot be underemphasized. So we believe strongly in providing kangaroo mother care, which is continuous skin-to-skin contact and involving families very early in the process of the ICU care or process of neonatal care that is being delivered. Family-centered care involves early empowerment, education, and awareness of families, involving them in caregiving activities and planned and informed decision-making, educating and empowering mothers to take care of the babies post-discharge, and providing emotional support during the critical phases when the babies are unwell. It also involves developmentally supportive care, managing pain and stress for the newborns as well as their families, providing them a swaddled environment, maintaining temperature, providing breast milk, and for all this we also have a human milk bank that is provided, that is available round the clock. I'm very glad to represent our entire team, which includes a highly qualified team of neonatal intensivists and pediatric intensivists. You can see their names and the qualifications on the screen. We also have trained pediatric super specialists catering to pediatric cardiology, nephrology, and other allied services. Thank you very much.
I would like to now announce the arrival of our Chief Guest, Her Excellency Dr. Srimati Tamilisai Soundararajan, Hon'ble Governor of Telangana State and Hon'ble Lieutenant Governor of Puducherry in our midst. Shall we all rise for the national anthem?
मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you very much. Kindly take your seats. I would like to now invite our dignitaries on the dais to light the lamp and inaugurate the session.
गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरी
A very warm welcome to our chief guest once again. Now I request Dr. K. Shilpi Reddy Garu to deliver the welcome address.
I welcome our Honorable Governor, Dr. Tamilisai Soundararajan Garu, Governor, State of Telangana, and Lieutenant Governor, State of Puducherry. Madam, in spite of her busy schedule, she took out this time of hers for Women's Health Conclave because Madam is a strong advocate of women's health. When I went to talk to her also, she was telling that the difference needs to come in the society where women's health needs priority, and we should do programs that actually help evolve women's health in the right direction. Thank you, Madam. Thank you so much. And our Honorable Director, Dr. Bhaskar Rao Garu, has always been in the forefront encouraging us to do programs which actually benefit the society and make that difference that what the change that we need to get in the society. Thank you, sir. Thank you so much. And as a part of the initiative, the Anitha Garu, our director, and our neonatologist, Dr. Aparna, has been in the forefront encouraging us to do this program. And Dr. Durga Rao, director of Oasis Center for Reproductive Medicine, she helped us in giving her own insight into this event by being a part of the event. And Dr. Janki, she's our dermatologist, and she is also an evolving person who has taken care of this event. And women's health per se is of utmost importance, whether it is an infant, a child, an adolescent, a young woman of reproductive age group, a perimenopausal or a menopausal woman. Every stage of life, there is the necessity of health and wellness that has to be incorporated into her life, because it is always said that the nation reflects a woman, and women's health is a perspective that we all should get into. When a woman is healthy, the entire family, the society, and the nation is also reflected with her health. Here comes the initiative of giving importance to women's health in this way. Thank you so much.
Thank you, ma'am. Now I'd like to request Dr. C. Aparna to introduce our chief guest to us.
Thank you very much. It's indeed my honor to introduce Madam Dr. Tamilisai Soundararajan Avargal to all of you. Being an exemplary politician, administrator, obstetrician, gynecologist by profession, a philanthropist as well as a mother, Dr. Tamilisai Soundararajan Avargal has been a role model for working women, multitasking and balancing multiple roles and responsibilities every day. From very early in her career, Madam has served the Tamil Nadu Bharatiya Janata Party in various capacities, starting from the Chennai District Medical Wing Secretary in 1999, stepping into multiple responsibilities before eventually being elevated as the National Secretary of the party in 2013. Madam is a remarkable public and social service background spanning over 20 years, and she has an illustrious political career in the last 2 decades where she has successfully led the state unit of a political party with noteworthy accomplishments. Dr. Tamilisai Soundararajan started her career as a medical practitioner after completing her MBBS, post-graduation in gynecology obstetrics. She has undertaken special training in ultrasound and fetal therapy at Toronto, Canada, and she has worked as assistant professor of Department of Gynecology at Sri Ramachandra Medical College in Chennai for 7 years, and then took over full-time political engagements. She nurtures great devotion towards public service and enhancement of living standards of the common people, with focus on health and education as the primary agenda. She has donned the hat of being a state head of a political party and steering it with exemplary management skills and pro-people service milieu. Madam is a proud recipient of an international award titled the International Rising Star of the Year 2018 by Multi-Ethnic Advisory Task Force of the United States of America, and she is known for her strong advocacy towards uplifting living standards of people through better health and preventive care. She is a great admirer of social and cultural strengths of our country and very considerate towards the inclusion of values and humility right at basic education system and upwards. She is the first woman to hold the office of the Governor of Telangana, and we are extremely glad and privileged to have her esteemed presence for the inauguration of our Human Milk Bank last year. Madam was kind enough to grace this occasion. On behalf of the KIMS Cuddles team, we extend you a very, very warm welcome, Madam. Thank you so much.
Thank you, ma'am. Despite her busy schedule, our Honorable Governor has spared her time with us, so we will have a quick interactive session for about 10 minutes. If there's anything the audience would like to ask her, you're welcome to do that. Ma'am, you can just come to the front. Anyone else that would like to ask questions can come and be seated here.
Good afternoon, ma'am. Good afternoon, Governor ma'am. And thank you, KIMS, to inviting us. I'm from Tech Mahindra, myself Anuradha. I would like to ask you one question, that is, nowadays you can see that that's a quite personal question, but I wanted to phrase here. Women are facing a lot of sexual mental illness. What would your suggestion on that? Because you are a gynecologist also. Thank you, ma'am.
My special good afternoon to each and everyone here. First of all, I congratulate you for asking a question which is really very, most of the people will be hesitant to ask the question. And this is a problem with women. Whatever the problems they have, they are not open and they don't ask with open mind. And in spite of their sufferings, they won't come up boldly to know the answer. So I really appreciate you. And sexual problem, particularly it can be either the normal married life or the sexual harassment which occurs in the working place, and it may be in the education institution, the adolescent girls facing it. So it can be very problem which we face. But my advice is, from the childhood, when they enter the adolescent age, awareness should be there. They should be aware of the situation. Actually, we all feel that we are all very modern and now we are teaching the children properly, but not. Always you have to connect with our roots. Some of the programs, festivals, functions are carried out in our society. And nowadays the Menarche festival and the Valagapu, the Simandam festival, we are all looking at with a biased view. But when a research was done, when I was PG in Ramchandra Medical College, the holistic approach and the research was done, they were very safe. Nowadays, they are facing the sexual harassment, and nowadays they are unable to cope up with the life. But our elders, our ancestors, mothers, grandmothers had a very smooth sailing. We think that they are cowardish, and they were very much successful. So the society taught us naturally the awareness. For example, in a village, if a menarche function is conducted, then the other children know such developments will be there in our body, and there will be a phase we have to cross. And when we were, some of the students, when we were doing gynecology, were criticizing this Valagapu. So what is this? They are calling everybody, and then one of the elder when we had a small interaction, whether it is useful to the society or it is only a luxurious function arranged by the family. Then some of the elders told, because when such programs are conducted, festivals are conducted, it conveys a message to the other youngsters, because we have to undergo such physical changes in our body. So it is not only unique to us. So it is natural thing which is happening in all the other women also. So that awareness should be there. And nowadays we are hesitant to talk with our children also. When they start talking about something, so we stop them. No, this is not the subject to be openly discussed, or this is not the subject. So when they grow into an adolescent girl, and when they enter into the married life, or when they go to the professional, their offices or their career, when they face with such situations, they are unable to reveal it outside, and that makes them depressed, and makes them unhappy. So first of all, we have to have a good interaction with the children, and now we have to make them aware of the problems. And if at all you are facing, as you said, then you have to have a good consultation with a gynecologist or elders, or you can have a good counseling. So nothing wrong in revealing certain things, so that getting the solution.
Thank you very much, ma'am. Anyone else that would like to ask a question?
I would like to ask a question.
Yes, ma'am, please go ahead.
Thank you so much for the opportunity, ma'am.
Who is asking?
I am asking. Ma'am, here I am.
Yeah.
Ma'am, I'm Gautami. This is a great opportunity for me to ask you a question. So, I am representing a working woman. It's not easy for a woman to handle so many chows at home and manage to come to work and give her 100%. You are a fellow working woman too. How did you manage your mental health, physical health to give your 100% and to be in a state where you are?
First of all, start enjoying your work. Whether you have one state or two states, start enjoying. Don't think it is a burden or that is a responsibility. I start enjoying. In a lighter sense, I can say, when I was coming in the flight, I have 2 cell phones in my hand. So an elderly person was sitting beside me. So when I was taking my one phone got dropped. Then he was telling me, we are unable to handle one phone. How can you handle 2 phones? Why are you having 2 phones? I told him, I am handling 2 states. What is the problem in handling the 2 phones? So it's all with the mindset only. And I always enjoy doing, because if another responsibility is given, there's an opportunity to show our talents and show our administration. So it is always take it as an opportunity. But plan your life. I always ask, when I was practicing, the ladies used to come and tell, Doctor, tension, for everything tension. What tension? For which saree, which blouse to wear, that's a tension. Then which Colombo to keep tension, which side dish to tension, whether to do what is idli or dosa, that is the tension. So why can't you in the evening when you are seeing the serials? So tomorrow morning, what will be my tiffin and what will be my dress? Everything is a little planning and little time management will definitely help you. And I always don't get tensed. When I was attending CEO's conference, there was a 2 days discussion. And they were telling, I was asking, what we were discussing. So they were telling, no, we are CEOs. We are unable to get the service of our employees because we are expecting more. And the employees are what they, according to our expectation, we are not getting our employees. So we are tensed. We are unable to get the service. So I told in my valedictory program, I told it's very simple. For example, when we expect everything from everybody, you satisfy yourself by certain things. So I was telling in that meeting, 2 days you have conducted a conference. I will tell you one simple thing, because in my house, I have a driver who is working for 15 years and I have a cook who is working for 20 years. Then one of my friends came and asked me, you are having your driver for 15 years and I am in my house, every month I am changing my driver. Cook you are having for 20 years, I am changing my cook at least in 15 days, I am not satisfied. Then I told them, she was asking me, so she is good in cooking everything. Then I told, no, I love dosa, but she is good in cooking idli. So I started liking idlis. Then searching a person who is making good dosa. So it is easy, no? So searching another person who can do good dosas, practicing eating idli which she is doing. So it solves the problem. So it's all in our mindset only. So let us enjoy and adjust to the situation. But our motto is just you have to exemplify in our small things. So focus should be on our work and don't compromise your happiness for anything. Let whatever the work, I always say that God, whatever may be the load you give me, but strengthen my shoulders to hold the load. So that is the conviction we should have. So always enjoy what you are doing. Whether your officer gives you another file, when you are about to start 5 o'clock, you are called and given 2 or 3 files, then smile. I have an opportunity to see more files. So that is the mindset you have to have.
Thank you so much, ma'am.
Excuse me, I've got a question here. Very warm good afternoon to all the dignitaries on the... It's me, ma'am. Very warm good afternoon to all the dignitaries present on the dais, Hon'ble Governor of our state, and all the, VIPs who are here for this event. Ma'am, basically my question is to you and Team KIMS as well. I was just listening to all the facilities and the advancement of technologies which are available with the hospital over here. It's a very good thing, and now the question comes about affordability. My question is, all these facilities can be availed by people who are able to afford. So ma'am, as you are heading as a state, why can't we introduce all these facilities in a subsidized rate or free for the below poverty line people? The mortality rate is high even in those communities. There are children perishing, neonatal kids are perishing without proper treatment. So my question is, why can't the government come forward and also have such kind of centers where they can go and avail these facilities?
And definitely there are centers, but this is the question. Through your question, I want to convey the message about health insurance. The awareness about health insurance is much lower in our society because it is very difficult. Governments are coming out with schemes, for example, Arogyashri, Ayushman Bharat, and even 5 lakh rupee treatment, we can get it done freely. And I laud our Honorable Prime Minister because women oriented, before cesarean was not included in the insurance scheme. Most of the insurance companies say only diseases we include. But Ayushman Bharat, first when it was introduced, it was cesarean section was not included, and because of the appeal from the womenhood, it was included. So now, first of all, we should be aware of what all the facilities available in the government hospitals, totally free, and what all the facilities available in the government hospital in subsidized rate, and what all the facilities available in corporate hospitals. particularly KIMS. I really appreciate this. Your Bhaskar Reddy Garu is here. When I knew about their work on breast cancer awareness and taking the awareness to each and every village. So mammogram to be done in a corporate hospital, they have to come here, register, but they are taking the mammogram towards the people. So, but we should be aware of the services. For example, medicine, where we can get. Nowadays, there are this Janaushadhi shops are there. Not all medicines we can get, but some simple generic medicines we can get it. And these all the facilities already available for the poor. But I always appeal to the governments. Even Telangana government recently, when I attended a medical camp, I appeal. All the facilities should reach the people. So that awareness should be created, particularly the womenhood, because this conference is about women health. Actually, there was a survey, some 30 years back, there was a survey that before under 5, male children were more sick and the percentage of male children were more, and there were no very minimal percentage of female children. Then everyone was very happy. Oh, female children are more resistant and they are not sick. Only male children are not with resistant and they are more prone to sickness. But that survey revealed that even the girl child is sick. She's not brought to the OP. So surveys also can sometimes deceive us. So they thought the girl children, there is no any percentage of more percentage of girl children attending the OP. So the girl children are more healthy. It's not that. The sick girl children were not brought to the hospital at all. Their health was ignored. So we have to find out the places where the facilities are given free of cost, nominal cost, even in the corporate hospitals. Nowadays, even they are treating the poor. So we have to be aware of the situation. Most of the governments and the corporate hospitals and all the insurances are coming out with good schemes.
Yeah, ma'am. Actually, I'm heading a health insurance processing company only. So that's the reason I thought I will just ask this.
Yeah.
And ma'am, any idea when is the Ayushman Bharat being implemented in Telangana?
Yeah, because when I came here as governor, I knew that I found that Ayushman Bharat was not implemented here. Then when I had a discussion, at that time I used to discuss with the chief minister. So when I had a discussion with him, I was telling in Tamil Nadu also, Ayushman Bharat, when it was introduced, there was a CM scheme. But both CM scheme and PM scheme combined, more than 80,000 people added more to that scheme and people were benefited. So even though don't actually argue whether this state scheme is better, central scheme is better, central has come out with this insurance scheme, state is having its insurance scheme. So and when both incorporated combined, the people may be benefited. Then after that Telangana, then I also gave him the report from Tamil Nadu, how the central and state schemes combined to help the people, and after that they signed an MOU to follow the Ayushman. That after my small effort, it was done. So when state and center cooperatively do, the great things can be done to the people. That is my
only
view.
the signatures have been done, ma'am. Implementation, I think efforts are required for that as
Oh.
well, which from your end.
Oh, because I am not following and they are not interacting with the health officials for the past 2 years. I am unable to reach out there. So it's a news for me. So I will put all my efforts to follow that, because I also told about some of the added points in Ayushman, because Arogyashri is our state insurance. Ayushman, if a person from Telangana get the treatment done in different state also, Ayushman can be actually
Utilized.
it is utilized. So these are things, good thing you told me, so I will put my efforts
Thank you so
in
much,
that.
ma'am.
Because in the previous program also I told this, but I don't know because it's only in the in this form.
signatures
Yeah,
have
I
been
don't
done,
know.
no
I don't know.
implementation work
Yeah,
has been.
I will put my efforts.
Thank you so much, ma'am. It was really
Because in
nice.
Puducherry, where I am the additional charge, Ayushman Bharat is utilized to its maximum, and we had we were awarded a prize for that. Second place we had for implementing Ayushman Bharat. Because as a doctor, because I am direct in administration, I could do that.
Thank you very much, ma'am.
Thank you so much, ma'am, for sharing your insights
Thank
on
you.
this.
Thank you.
And you've given us really very useful insights on how to go about in our workplaces.
Yes.
Also. Thank you.
Thank you.
Thank you, ma'am. We will take one last question, and then I would request our Honorable Chief Guest to address the gathering.
Thank you, ma'am, for your.
Oh, okay. She and then, okay. Both can ask, no problem, because.
Sorry, I didn't.
Both can ask. After that, you can ask.
My name is Hima. I'm from Open Text. I'm working as Senior Manager, leading security. Ma'am, what's the secret of your energetic leadership? There are like so many apps and fitness programs, yoga, gym, and cycling clubs. There is like marathons. Like, what do you think that as women we should focus on the health regarding this related to this fitness? Because an energetic leader will always improve the productivity of the corporate and also can balance work and personal life as well.
Okay. Changing the obstacles into opportunities. That is the secret of my energy. When the river flows, suddenly if there is a block, electricity will be produced, no? So I will be moving very fast. If there is any challenge, then I will be more energetic. So that is way. And it's a very good question, because basically I used to say, we can say that Sri Rabindranath Tagore says, you'll be longing to see Niagara Falls there, here, I want to go there, but you fail to see the drop of dew just on the top of the grass in front of our door. If you open it, it is the nature gifted with a dewdrop on the grass. We don't enjoy that. No, we'll be longing for greater things. So don't think that you have to go gym. And I have not gone to gym at all. But I do yoga for 1 hour. Definitely 1 hour I do yoga. And I walk, morning half an hour, evening half an hour I walk. Because I walk only, whether the floor, whether the challenges, whether it's ups or down, I will walk. Definitely. So only I am in Telangana, I am facing all the challenges, but I can walk. I can move through. I can move through. Anything I can do. Because early morning you get up and thank God for giving the opportunity to rise in the morning without any sickness, and drink lot of water in the morning, and then start your yoga. Don't be lazy. Yoga, meditation, and actually allot some time for you. Don't think that files, work. Definitely I allot. When I go to the colleges, when I ask them, how many of you do yoga? Very less number of children raise their hands. Then when I ask them, they used to tell, no, I don't have time. Then I used to tell you, Governor, handling 2 states have time to do yoga for 1 hour. Then are you busy than me? I used to say, no, we are not busy. So why can't you allot time? So if you allot time, no, if you can, the productivity will be more. Don't think that 1 hour is waste. I can do 48 hours work in 24 hours. I can challenge. I am doing like that. Everyone will think, now you are in Telangana, now you are in Puducherry, now you are attending a program. Yesterday morning I was in Goa. Evening I was in Visakhapatnam. And now I am in Telangana. Evening I will be in Puducherry. So this is how we have to tone our body and mind. That is practice our mind. So physical fitness is very, very important. So only our Honorable Prime Minister always says fit India. So we have to be very cautious about our food. I always say we are counting our currencies. Are we counting our calories? Yeah, hardly. We have to. If I take on ice cream, no, I will just stop with I like ice cream very much. But I don't deny tasting it, but I will take it and within quarter ice cream I will stop. Okay, this is more than enough for my body. So I am not deceiving my taste buds. I am not deceiving my body. I am enjoying at the same time, but limiting. I am limiting myself. So food also. Always have a small plate. Now small plate concept is there. 3/4 of the plate should be with vegetables and fruits. Only quarter plate. It's easy, no, for you. You can tell so that you don't need to cook, no. Otherwise, put sambar, rasam, and put to cutting, and you easily tell your husband, no, this is the now new concept. All cut vegetables 1/4, cut fruits 1/4, and some cereals 1/4. Only little the rice. For that you need not have too delicious Colombo this and that, because rasam and all, you just take some curd and eat it away. So your work is also minimized. So always follow these things. So it will be easy for you also. So nutrition, food habits, altered food habits. Our Honorable Prime Minister life is a small changes. So that will improve our environment. Like little changes. If you are eating 4 idlis at a time, 2 idlis by 7 o'clock, then spread it to 10 o'clock 2 idlis, then definitely that will help you. So plan your diet and plan your habits, but mentally always free. And I always, finally, to everyone I used to say, don't compromise your happiness for anything. Life is for enjoying. If you want to get a sari, go and get it. You want to get a jewel, go and get it. No problem at all. But you should be very healthy to see your husband. So now I have got it, but I will cooperate with you more, whether in business or in family. So that will get great results. So small lifestyle changes is more than enough. It's not that you have to spend more. You have to spend more for the nutrition. Sometimes they will know for protein diet. So that is 700 I am going to get. And this 600, no, nothing. A white egg in the morning will give you more protein than any other nutritious artificial food. So be natural. Always think of our mother, grandmother, what they took, you take that. That is a simple solution for you. My grandmother lived 80 years, my grandfather lived 90 years. They took every day little vegetables, fish they took every day, some buttermilk. So very simple food they had. So always plan your life and diet. Planning is more important.
Thank you, ma'am.
Okay, thank you very much. I have very less time. I always love to answer because I will be talking to you. I don't know what you want, I'll be talking. But now I answered what you wanted and then I answered. It's really a great interaction session. And I always want, in every program, you have to utilize the opportunities given to you. When you utilize the opportunities only, we can get some. I'm not saying I'm a great person, but we are successful. They used to ask me whether you are an extraordinary person in this age, you became a governor. I'm a very, very ordinary person. I also like saris, also like flowers, jimkis, bangles, everything I like. I'm a very, very ordinary woman, but I do things in an extraordinary way. A simple thing also, it should be done. My work should be on top. My work, even Raj Bhavan, I'm not confined to Raj Bhavan because today also a paper has reported how I have taken forward the work of tribal activities. So we have to focus on our commitment. Whatever may be the problems we face, definitely there will be challenges. I can say, Bhaskar Reddy garu, please pardon me. And if a man should come from the other brothers also should excuse me. And other media friends also, male members should excuse me. If a man want to come out from the house, just he can take an iron shirt, put it and he can come away. But for a woman to come out from the house, she has to look after whether you have to cook the food and whether it should be kept in the dining table. And when mother-in-law, you have to be very careful. When mother-in-law will come and whether she will eat and when the children will come and when the milkman will come and deliver the milk and when the postman will come and deliver the post, with all these calculations, you have to come out. So one woman coming out successfully is equal to 1,000 men coming out successfully. So it is not easy. By my personal experience, I will be not my children are grown, all are doctors now, but when my child was there, I will be doing a cesarean. Then my child will, where is my pencil? Ask my mother immediately to answer her. Then I tell my assistant will come and tell, your child is calling repeatedly, what is the problem? No, I'm having a knife. No, she's asking about her pencil. So this is the challenge. She won't ask her father. She will ask her mother only. Then sometimes we will have, birthday program is there. We will come by 7 o'clock. At that time we will have a cesarean. At that time we will have, we will be changing our dress. We will be stepping out. Suddenly one patient with pain will come. The other relievers wouldn't have come. So immediately we will be forced to go to the theatre. And another 2 to 3 hours, the child will be crying there. Then these are all the challenges we face. So we have to face the challenges. There are difficulties, but women are multifaceted. They can do anything. They can do anything, whatever the work you give, and this is a land where Rudrama Devi, like leaders were there. So I'm very confident that women are really good administrators. Why means it is for men it is very difficult to manage a woman, but for a woman it is very easy to manage everyone, even a man. So as an administrator, I am telling with my experience. So we can be very cool, and that is it's all in our hands. So only some of them are not allowing us, because if you allow a women, definitely they will catch the place. So they will exemplify. So only even now our legs are full. But in spite of that, we will run fast to reach the goal. And apart from that, my request is the family and awareness. Nowadays we know about breast cancer, and there are some diseases. Heart problem. When I was asking my relative about heart problem, women will have heart attack. Then she was saying, no, women won't get heart attack at all. Only men will have heart attack. Then one of the person told, no, if I have a wife like you, definitely men will only have heart attack. In a lighter sense, he was telling. But women also get heart attack. Women also should be aware of another thing. More women are now affected with brain clots. So these are all things which we are not aware. Osteoporosis, we are not aware. And all the other, we are aware about, nowadays we are aware of ovarian problem, uterus problem, but other medical conditions also will affect the women. So when we have some symptoms, when we experience some symptoms, immediately we must go to the hospital. Yearly checkup is very much needed. You don't plan that for this birthday I have to get this sari, I have to get this jewel. For the birthday, because we are passing another year, definitely you have to have a medical checkup. So that should be the gift. I appeal all the husbands, please gift a voucher for the master health checkup than giving a voucher for the sari, or it should be done, whether it's a previous day or after, but whenever before celebrating your next birthday, you have to have a full master health checkup. That is very, very important, because the diseases which are diagnosed much earlier. Now there are treatment for everything. Anything, because before and all cancer means, oh, everyone will be afraid. Oh, in cinema and all, cancer diagnosed means dying, like that, all they will show. No, very calmly. I have seen even our Reddy also attended a program to give awareness about health, breast cancer. The survivors, they didn't have any shadow of breast cancer. They came and they revealed their helplessness. So there are opportunities. Give the doctors also give the opportunity to save you. Don't come in a very chronic stage. Don't ignore your health. You know, if it is a plant, if the weed is very small, it can be easily plucked. But if you grow into a tree, it cannot be plucked. It cannot be cut also. So always aware of this. But another thing, nowadays the incidences are more, whether it is uterine cancer, breast cancer, or hypertension, or sugar. It is very difficult to cross 40 without either hypertensive or sugar. So it is, you have to be much aware of it, and you have to spend some time for that also. It may be a repetition. I always narrate one incident. When I was a postgraduate at Ramchandra Medical College, when we were postgraduates in the Department of Gynaecology, usually there will be an annual event. When I entered, there was also a jewelry exhibition in this campus, like that. An exhibition, the annual exhibition will be there about saris and all the cosmetics which are used by the women. So once a year it will be conducted, and lakhs of women will attend this program. So when we were PGs, we asked our HOD, Madam, large number of women will be attending this program. So we will hire a stall with all our efforts. Our PGs will collect money, and we will hire a stall, and we will have an awareness program. So that whole night we sat and drew pictures about breast cancer, pap smear, how it can be diagnosed at the earliest, everything. And then we displayed all the charts, and we had a mobile mammogram there, and then pap smear kit there, and then with coat, with stethoscope, we postgraduates were sitting. So ladies started coming. So first this was sari shop. So ladies came, They put the sari this shoulder, that shoulder, and they saw in the mirror. Then we were ready because next they have come to the sari shop. So next they will enter our stall. So that we put a coat and then we were ready with the stethoscope and everything. These ladies, no, they entered the sari shop. Quickly they passed our shop, our stall, and they entered the jewelry shop. Then we were watching, nobody entered. Then we pulled them. No, if you are doing that, if you are hale and healthy only, you can wear the sari and you can wear the jewel. Then you won't believe, after we compelled everyone, they attended, they came to the stall and they had the checkups, and 300 patients were diagnosed with precancerous condition. Either it was breast or uterine. In that, some 2 lakhs, 3 lakhs people attended, 300 people were diagnosed with precancerous situation. Only just screening helped them. Otherwise, they would have come up with uterine cancer or breast cancer in a later stage. So, always concentrate on your health. That is wealth. First preference is health, health, health. Everything is next only. Your profession next. Whether your luxury or your academics, everything is next only. First health. சுவர் இருந்தால்தான் சித்திரம் வரைய முடியும்னு தமிழ்ல ஒரு பழமொழி இருக்கு. If you have a wall only you can paint. If you don't have a wall you cannot paint. One person was telling, no, I want to go to, every day I want to go to the office exactly by 9 o'clock. Then his friend asked, no, every day you want to go to exactly punctually 9 o'clock, why can't you go? No, I don't have a job. If I have a job, I will have a job. So, intention may be good, but if you have a healthy body only, mind only, so always be free. Life is for happy living and health is more. You may be a very big academician, you may be a very big artist, but small headache just collapse you. With small, it may be not bilateral, migraine will collapse you. So always be healthy. That is the message, and I really appreciate the organizers, particularly Shilpa Reddy Garu for organizing such a program, because whatever maybe, I always tell a small story and I will complete it because I have to go and catch the flight. There was a farmer. He was a very poor farmer and he wanted to sell his land, because unless he thought unless he sell the land he won't counter his poorness, poverty. And then he asked an advertisement person to write an advertisement, because everything nowadays are for advertisement only. No? He asked the person to write an advertisement. Then that person wrote an advertisement. This is a piece of land is there, and there are 2 to 3 guava trees where we can get good, very delicious guava, and there are some coconut trees in there, something and all positive. Then he told there is a school nearby means 60-70 kilometers. The advertisement will be like that only now. So he told nearby school, nearby police station, this station, that and all. He wrote and he gave the advertisement. Then that person told, no, I am not going to sell the land. Then the advertiser got angry, that media person got angry. Just few minutes back you told you are going to sell the land, and after writing this advertisement you are telling you are not going to sell the land. Then the advertiser told, that farmer told, till you write this advertisement I didn't know so many good things are in my farm. But when you wrote the advertisement, then I now think why I should sell the farm. With this farm itself, I can live a very happy life. So sometimes somebody should reveal what all available and what all the caution you should follow, so that these type of programs help us to caution us and to know what all things available and what all the preventive measures we have to follow. So I really appreciate Kirti Reddy Garu for Shilpa Reddy Garu, because Shilpa Reddy Garu for her very good initiative, and Bhaskar Reddy Garu for encouraging him. What's your name? Durga here. Dr. Durga for a fertility specialist. Anitha, Director KIMS Hospital. Dr. Janagi, dermatologist. Aparna, neonatologist, for helping Shilpa Reddy. Shilpi Reddy or Shilpa Reddy? Shilpi Reddy. So anyhow, popular person only. So because too many names, before only I was attending another program where all Reddys were there. So, Reddys. So I'm really very happy to attend the program. Thank you so much. You are so... Bhaskar Rao. Bhaskar Rao, oh, you're Rao. So there's no problem. So sorry. So Bhaskar Rao Garu for this thing, because I didn't have any paper. Then I just came here and but I have seen him in all the programs because I am attending too many programs that Rao or Reddy. That's no any problem, I think. But anyhow, we are all good humans. Whether you are Rao or Reddy, we are all good humans. So that is very important. So I am really very happy to attend this program, and I see the multicolored women here. I always love to attend the women program because men program will be very black and white or some. So it is multicolored. I am really very happy to attend this program. Lovely ladies, thank you so much.
Thank you very much, ma'am, for your invaluable insights, your advice, and your assurances, and sharing your experiences with us. Now I request the dignitaries on the dais to felicitate our chief guest. Thank you very much once again, ma'am. Now I request Dr. Sudhir, Medical Director, KIMS Hospitals, Kondapur, to propose a vote of thanks.
Good afternoon, ladies and gentlemen. On behalf of KIMS Hospitals and KIMS Cuddles, with a profound sense of gratitude and appreciation, I would like to extend my deepest thanks to our distinguished chief guest, Hon'ble Governor of Telangana State and Hon'ble Lieutenant Governor of Puducherry, Dr. Srimati Tamilisai Soundararajan Garu, for taking time on a Sunday to be with us. In fact, I've never seen this side of Madam, which is fantastic to enjoy, and the advice about awareness, health, and happiness is well received and well taken, Madam. I would also like to thank our visionary chairman and managing director, Dr. Bhaskar Rao Garu, and CEO Dr. Abhinay, who have always stood at the forefront of women empowerment. In fact, close to 40% of our employees in KIMS are women. It's a true testament to this. My sincere thanks to all my consultant colleagues, the media for spreading the message of women empowerment and health, and all the eminent speakers on the dais who at all times have ensured the highest quality of care and compassion to women's physical, mental and social well-being. A special thanks to my COO, Dr. Sudhakar Naidu, and the entire team of Cuddles who have relentlessly worked to make this event a grand success. And of course, the greatest gratitude is to the women who entrust us with their care delivery. Your strength, your resilience and the trust in our medical team inspire us to provide the best possible healthcare services. We are humbled by the opportunity to be part of your healthcare journey. Lastly, a big thank you to the audience who have attended the event today. May we work together to uplift, empower women, ensuring their health and well-being for all the generations to come. Thank you.
Our chief guest has to leave because of her busy schedule. We will continue the program. And all your questions will be answered by the experts on the dais. Can I request all of the audience also to rise for the national anthem?
I request everybody to be seated. We'll have an interactive session after the talks, and every question that you have would be answered in detail. Please be seated.
Now I'd like to request Dr. Durga Rao, founder and medical director, Oasis Fertility, to kindly come and deliver her talk.
Respected Dr. Bhaskar Rao, I won't make the mistake of calling you Bhaskar Reddy. But a huge applause and I think gratitude to envision something like this, Dr. Shilpi and your colleagues. Because even though we keep talking about things, I think the reach that we want to have in terms of improving women's health care and the things and the facilities that are available, I think, the word has to reach out about the accessibility that is available right now. And to enable that word to go out, I think the different ways that they are reaching out to do that is extremely powerful and very enduring to see that it's not just about asking people to come to the hospital and avail the services, but to ensure that the word in terms of preventive care is also going out there. Coming from a corporate hospital is, I think, something that has to be applauded for. And, to ensure that where most of the women's workforce is, which is the companies that are working, and how are we going to get the word out to them to see what are the facilities that are being available for women out there is something that I think is a need of the hour, and for them to have recognized it and to have brought it to this particular stage and, audience, I think is extremely important. Now, when we are talking about women health care, the most important thing is we don't want a woman to reach a point of coming with a disease. The point that we are actually talking about and where India has to take a stand is to make preventive healthcare measures. So the word is not about treatment, the word is about prevention. So that is where I think, as leaders and the different aspects of the designations that you hold in your companies, it's very important that the women workforce that are there in your, particular companies or whichever organization that you're working with, the word goes out in terms of prevention rather than cure. And when we're talking about prevention, you're wondering where I'm coming from when we're talking about fertility. Where is fertility a preventable medicine? But frankly, right now, looking at where the situation is, we are talking about prevention. Now, India, you say, such a populous country. In fact, when I was introducing myself to a very senior doctor in the beginning of my career, when I told him I was a fertility specialist, the first thing he said is, you're very anti-national. So I said, what do you mean by that? He said, in a country that has such a huge population, you want to increase the population, and therefore, what good are you doing for the country? I said, how many children do you have? He said, 2. I said, then you can't be talking about, the concept of anti-nationalistic when you already have 2 children. What about the people out there who don't have any children? What are we doing about them? Now, here again, when we are really talking about, when we are such a populous country, is fertility really something that we have to worry about? The answer is yes. Because frankly, 1/10 of your population could be leading towards infertility. Why else is it important? It is important because when we are looking in the past, our fertility rate was at 5.9. Where are we now? We are at 2. And if we go any lower, what is really going to happen is your population is going to actually start dwindling. For a population to keep at the same rate, your fertility rate has to be at 2. If it comes below 2, that means your population is going down in the future, and not just that. The reason why it is detrimental is because your whole economy, your GDP, everything depends on it. And that goes down, so does your country's future. Now, when we are really looking at this, this is the graph. Look at how it was in the 50s and look where we are now in the 20s. Now, when we are talking about our particular state, we are exactly at 1.8 to 1.9, which means that if we are not going to get there in terms of improving our fertility rate, we are going to be one of the few states in the country in which our total fertility rate is down. And if you really look at the ones which are above 2 and above, it's only in the north. And when we are really looking towards the south, our fertility rates are going down. In fact, in some countries, particularly in Japan, they are inviting people to actually move to Japan. They're giving them jobs, they're giving them housings so that they can actually maintain their population to the state that they can continue with the economy that the country needs. Because most of their population is actually geriatric population. We don't want to get there. I'm not saying that we're going to get there tomorrow, but if we continue the way that we are very soon going to be there. Now, when we are really looking at what's actually causing the infertility rise in terms of the population that we are at, there are lots of reasons. Some of them are medical, and obviously we are talking about cure there, but there are certain conditions which have to be prevented, not just in women, but also in men, wherein we can stop this cascade of people or couples going towards infertility. Now, yes, it is on the rise, and if we don't get to it, there's going to be a problem. Now, where do you and I come in? Once they get a problem, they come to the doctors, that's fine. Our point here is we don't want them to come to our fertility centers. We don't want them to need our services. They have to get to the point of actually recognizing the problems that are there in their lifestyle and see what they can do about it. And most of the condition, in fact, the top 5 conditions that is leading to infertility is your lifestyle disorders. What are we talking about lifestyle disorders? We are talking about their weight, we are talking about their, timings of sleep. And the reason why I thought it was very important for these organizations and the companies that are being represented here today is the kind of work style that is being offered to them, the kind of working hours that are being offered to them. I do understand that some of the companies do have to work in terms of your Western countries and who you represent or who you work for, and therefore you have night shifts and all of that. But what we don't understand that is that changes the circadian rhythm. A lot of women actually who are in that kind of a lifestyle are ending up having problems conceiving. There also this another thing which is extremely important. Yes, career is important. Yes, education is important, and like how has been discussed, girl child education more important. Once the girl child education is there, then in terms of the whole household, the quality of life that is being offered to the rest of the household, and the quality of the society in terms of the contributions, the economy, and everything is improving. But what tends to happen is once the girl child, the education improves, they go towards their career. And that's when the whole cascade of wanting to delay parenthood comes into the picture. And once a woman grows old, obviously, the chances of fertility, as you can see, rapidly declines after they cross 35. And when we are really looking at a woman's best career time, it's between 30 and 37. And that's the time that is also important for a woman in terms of understanding what her fertility conditions are. So by the time she actually gets, her foothold into the career, and once she gets to the point where it's actually going to make a difference for her, is when she realizes that, fertility and parenthood is something that has gone by. So when we are really looking at this, this is where the preventive aspect of things have to come in, give them the right kind of education, give them the awareness about the different factors that are going to lead to that, which is going to be your weight, which is going to be the stress at work, which is going to be the hours at work, and also the other aspects in terms of, because I see most of the companies that are there, because of the kind of workforce that you have, you always have a food court. But has anybody actually paid attention to the kind of food that is being offered to them? What are the kitchens in your organizations offering to them? What is it that we're actually doing in terms of their lifestyle? Like how the governor, madam, was talking about, we're counting the currency, but we're not counting the calories. And I think we're helping them do that. Give them the kind of food that gives them the satisfaction, and, that's the end of it. But what is it actually doing to the health is not something that any of us are actually paying attention to. So all the things that are actually contributing to their work environment, including the stress that goes with it, is what is actually leading towards infertility. So your lifestyles, the things that can actually make a change, that can be prevented, is what we want you to keep an eye out in terms of making at least the journey towards parenthood a lot easier. And when we're really looking at the problems, what is it that we're really looking at is have some kind of a labor reforms. Look at the kind of work environment that is being given. What are the work hours that are being given? How is it that you can improve that in terms of making her quality of life a little better? And when you're really looking at this, there are lots of companies that have actually gone on in terms of making these kind of changes. And if you really look at all of these countries, let it be Germany, Denmark, and even the other things like Russia, they are actually making things a little better for their women workforce. Are we there? Are we doing what is required for them in our country? Or at least let us start with the organization that you're working for to see whether you can make a difference in as how these countries have actually made a difference. Now, we all know about Facebook, and this is not new. This is something that happened in 2014. That's when they realized, when, just one woman went up to the HR and said that I had cancer, but because I could not afford fertility treatments in terms of preserving my eggs, nor did my insurance cover it, because I think you have some of the insurance companies here as well. Because my insurance couldn't cover it, I could not go for egg freezing, and she ended up the rest of her life, obviously adoption is a choice, but she ended up not having children because the choice was denied to her. That's when the company heads got together and decided to actually offer their women workforce the option of freezing eggs on their insurance and on their policies. And this is not just about Facebook. We have even got Apple and we have even got Google into it. Now, I'm not going to be talking about just the companies that are there. We have also got a few companies out here in India which have taken the step forward and got fertility onto their aspects in terms of covering for insurance. And as you can see, there are some of the companies which are out there who have actually picked this up, that this being a deficiency in the system in terms of their insurance, and understanding what the woman's workforce and health and her attitudes and what her desires are, and incorporate them into their aspects. So this is something that we have to look at. I represent Oasis Fertility. Now, I'm not going to be talking to you about this. This is not the platform for me to tell you about my organization, but this is basically a platform for you to understand that though fertility is there, what is aspect and what should be remembered is that this is also a preventable condition. There are aspects to fertility which are preventable, and we as the heads of the organization, that if you are representing women out there, and if you are talking about having at least 40% of your workforce actually resulting because and the contributions being made of women, I think it's definitely our responsibility to ensure that we do the best for them. And if you are looking at any organization to help you in terms of giving the right advice to your women workforce, I think it's important that you ensure that you get the right people to come and address them. Tell them what are the aspects that are leading towards infertility. What are the things that we can do to prevent the infertility? Identify the reasons or the causes that are leading to them. What else can be done for it? And if there are any packages that are suitable for you as an organization, get into discussions with the organizations and see what best we can do to help them. But always remember, it is not a life choice anymore. When we talk about, even when we talk about insurances, they think having children and infertility is, a lifestyle choice, like how you go and get Botox done for your face, or you're going to go for dermatological, or no offense, but, for other kind of procedures. This is no longer that. When we are really looking at a population, when we are really looking at India, when we are looking at the progress of it, unless the women progress, unless they at least have that 1.5 to 2 children, your country is not going to get to the place that we want it to. So give them the advice, make them aware, make the lifestyle choices, and give them the right kind of environment and the backup that they need to actually make the right choice. Thank you.
Thank you very much, ma'am. That was really informative. Now I request Dr. Janaki, consultant dermatologist and cosmetologist, KIMS Kondapur, to share her experience with us.
Hello everyone, good afternoon. I think I'm keeping you guys from your lunch, so I'll be really quick. I'm the consultant dermatologist, cosmetologist, trichologist, venereologist, and leprosy is all the things that we cover in our department. So what I wanted to talk to you all today about was skincare is a topic which is not seen with much seriousness. At least till the last few years, it was a topic which was ignored. Dermatologists are doctors who were not taken very seriously, at least till the last few years ago. Now there is suddenly a lot of increased interest in this specialty, and people are aware of what work we do. This is because a lot of women are also very aware of the way they look, and they want to age more gracefully, they want to look good. So that is giving a lot of importance to the largest organ of the body, which is the skin, which also represents you all your life, and it is the organ which is I think exposed to the most amount of wear and tear, because it's exposed to everything that we are exposed to. And the skin also represents exactly how you feel internally and is the biggest mirror of your health. So skincare has been a part of our life, like since many generations, since when Cleopatra used to take a bath with milk. Then our older women in our house used to use things like basin and malai to take care of their skin. And now to when all the ladies in the house would go to beauty parlors to take care of their grooming. Now it has come to a point where women want evidence-based medicine to take care of their daily skincare needs, and they want to look their best. Because here I want to introduce the word called skin confidence to you, where it's a simple word where you look at yourself in the mirror every day in the morning. You look nice, your skin looks nice, your hair looks nice. Automatically the confidence that you feel is different, and the way you go about your day is different, and the kind of productivity it gives is also very different. So at this juncture, I would like to tell you that we at KIMS Hospital offer all skincare services, and we follow an evidence-based approach to treat all skin problems, and be it gynecological problems which cause a lot of changes in your skin, like acne, hirsutism, which is excessive growth of hair, or losing your hair, or gaining weight, sagging of skin, or anything. All problems can be addressed very easily, and there are solutions which are affordable as well as very much available to you now. We also take care of pediatric skincare, and we help you achieve your best skin because we want you to glow. Thank you.
Thank you, ma'am. Before we open up the forum for questions, I would like to request our beloved Chairman and Managing Director, Dr. Bhaskar Rao Garu, to address the gathering.
Good afternoon, everybody. Is it the good way to question and answers or a speech? What would you like to have? Huh? Both. I think it's a great pleasure to be here, even though it's meant for women. I asked Shilpi Reddy, when there is everybody is a woman, why are you calling me? Sir, you are the back behind us to empower us. That's why I come here. Our director Anitha, the Oasis, you see the change. As an entrepreneur, brought the Oasis towards the national level. Am I told that in 90 centers? Okay. And Janaki, our dermatologist, and Shilpi, I think you might have seen how the delivery has been revolutionized. And I think you have been seeing everywhere. And Aparna, the neonatal care, how it has been improvised, quality, and as well as reduce the mortality and morbidity. So we are here to empower some of the people. Basically, I'm told that most of you are all from HR, so is the very, very important people in the organization. Many people doesn't know so many things, even though we are well educated. One is, many people doesn't know what is health. Health is not just absence of a disease is not health. It is the mind, body, and the disease. So when you want to keep all these things together, then only your health will be perfect. Many people are asking what is tension, how it is tension, and all those things. If you are able to keep two things, one is comparing, second thing is expectations. If you stop these two things from your mind, there is no tension. All these things will come from here. You want your child to be 100% marks. You are putting force on him and you are getting tensed. And God only knows everybody gets 100%. Where is the jobs? And when we were getting around 40, 50, we never bothered about it. The more important thing what we need is we need to build the culture. It is not the education that is important. The education, what is happening today, is not right for this. The education meant before was only to get a job. We are not gaining the knowledge. I was keep asking about what is the Newton's third law. Anybody says? Yeah, can you give an example? All of you know. Huh? You throw a ball, it will come back. You write that one, you get 100% marks. But nobody knows what exactly within that meaning. You throw a ball, it will come back in. You don't need to go there. Newton need not said that. You throw a ball, it will come back with equal force. But if you are able to implement that in your life, so many things. If you shout your wife, you will get back the same thing. You hit your son, you may not hit now, but you will hit later when we become old. So like that, if you are able to put that education system properly, then the problems will not be there. Many people are sending what all we have read up to intermediate. It's all waste. Say 18 years of our life we wasted. We are getting now, previously when there is a school, when you bunk, at least you will be on the playground. You learn a lot of skills when you are in the playground. Yet today, there is no school which has a playground. If you bunk now, there is no playground. You have to go to the pizza or Domino's or something, or movie theaters or some, or jewelry shop, or maybe saree shop, or pubs for the men. So then where you get? You are losing, you are not getting education, you are not getting your skills. So we need to transform. So the moment when you are able to put some comparisons and expectations, somebody is getting 90 marks, somebody is getting 80 marks, 100 marks, I want my son to be engineer or a collector or something, that expectations. In that expectations, you are killing the people. Today, anybody who is studying, more than 60% of the people are not studying for their sake. You are not able to identify their talent. They are all studying for the parents. Once they are studying the parent, then they don't have the enjoyment, they don't have the interest to study. That's why people are going. You are all in HR. How many people who studied their degrees, they are following the same job? Hardly 20%, except some professions like medicine, IT or other things. The rest of the people, they do keep on changing. And they keep on changing degree after degree, degree after degree, because they don't have anything. So the awareness should come, what we are doing and all those things. The second important thing, one question is asked about the affordability of the healthcare. We have built the KIMS hospitals. We have more than 4,000 beds across the Andhra and Telangana. We are expanding to other states. But we are all multi-specialty hospitals. If you look into the affordability and accessibility and prevention is the most important thing. 40, 50 years back, if you want to treat for the entire body, there used to be only one doctor. The same doctor used to train brain, the heart and the skin, everything. Today for a body, there are 100 doctors. So every specialty, subspecialization, in cardiology there may be 5, 6, in obstetrics and gynecology there may be 7, 8. So when their people are going into subspecialization, super specialization and minute to cure the disease, identify, so the number of people have been expanded. If you look into 50 years back, the technology wise, there was hardly X-ray. Today the technology cost, recent MRI is costing around 50 crores. 50 crores. The PET scan costs about 25 crores. The radiation is about 25 crores. The infrastructure what we need to build, previously the hospitals were being run by the only charitable organizations like societies. Today we need to build, government itself has decided that it is a business. And when we want to do a good infrastructure, previously even a 20,000 square feet we used to accommodate 100 beds. Today for every bed, minimum 15 to 20, 1,500 to 2,000 square feet we are going to allot. If you people come and paying and then they see all the facilities is there or not, this all will come to the patient only, because there is no other source is except the patient. So we need to make it an affordability. We want the 7-star treatment, but we want to pay the 1-star payments. The doctors are expensive. If you want to treat in the same specialty, you need 5 to 6 people has to consult. There is so many, at least 1:7 human resources is required. 1:7, one for one patient, we require 7 people. But still, it is unaffordable because it is lack of awareness about health and our budget of the family. The woman is the person, is the nucleus in the family. The rest of the people will be surrounding her. That's why I am telling all these awareness. The affordability of healthcare is very, very easy. Anybody can afford. Can you able to tell that? Any person can able to afford the highest standard of treatment that requires. The cost of it is only a cup of coffee. The cost of health insurance is a cup of coffee. If you people spend a cup, daily 2 cups of coffee, which costs about 20 rupees minimum. A family of 4 is 80 rupees. If you put for 3,000 days, how much we are going to spend? Nearly 30,000-40,000 rupees. If the same amount you put it for insurance, you can go it. Again, there is a problem with the insurance. Many people who go for insurance, there are 2 things you face. One, I am paying for the last 10 years. I haven't got any disease. Then the tension starts there. Unnecessarily I am paying. Then they stop it. Next year you will get the disease. The simple logic we are missing. You buy a car. You don't expect the car should go into accident. But you keep paying every year a premium. You travel. Your luggage has been insured. Your house has been insured. Your scooter has been insured. Everything is insured. Unless you are not there, your family is not there. But you won't insure your health. The moment you start ensuring your health, say for example, you spend about 20,000 rupees every year. It may be 100 years, you pay about 20 lakhs. But it is invisible for you. 20,000 is affordable by every standard. Suppose if you get a disease, you go to the hospital, you have to pay 40 lakhs at a time. The entire 10 years savings you have to shell down to the hospital, and you put the blame. So whatever it is there, unless you don't have the proper awareness what we are doing, how we need to be able to build it, you people being the HR, you need to, it is your primary responsibility to empower entire your employees. I keep on doing all these things to all my people. Many people think I have an insurance, or I have a CGHS beneficiary, I am a state government beneficiary, I am this. You may be here. Tomorrow you go to some other state, that will not be covered. You have to pay from your side. Offering for all these people, all the CGHS people, these IAS, IPS officers will be able to create these policies, systems. They themselves will come back for the treatment. They say it is a rubbish. For last 15 years, CGHS or state government rates have not been revised. But every year we have to revise our salaries in the organization, wherever it is. But nobody bothers about it. Then how can you be able to get a good quality care from the hospitals? So I encourage all of you should recommend to go for insurance irrespective of an employee or non-employee. I can see there are so many IT people, their parents will come back and get it treated very, very happily in a single room 5-star treatment because they have been insured. The one important thing to need to be is the affordability. It's very, very easy for healthcare is concerned. You need to change yourself the way the situations are moving on. Once you start doing this, make it a habit, then you will not be there. Today, in the worldwide, if any patient before admission, if he is above the poverty line, by paying the patient bills, he falls into below poverty line. It is a standard in the country. So we have an insurance, we have a state government. If you take the US model is entirely insurance, there is a problem. If you take the UK model, it is purely government oriented. Both are landed in problems. Their GDP is very, very high. Our GDP is very less. There should be a combination of insurance and the government and the private sector. That's why I created this Arogyasri scheme. I am the chief architect and the implementation. I made the Star Health people to come and put the premium for the government at the time. There's the first insurance company came forward. From there, the Ayushman Bharat or everything has come. And the awareness, what is, even today, Ayushman Bharat person can treat in Telangana. They are eligible to go and treat everywhere in India. Unlike Arogyasri. Arogyasri is only a state-run government scheme. Ayushman Bharat is a national one. You can go to any state, you can able to use it. So that much of awareness, somebody was asking, Ayushman Bharat was not implemented here, means it is there in Telangana. It is there every state except in Orissa. The state government didn't permit them. So like that, when we need to know what's happening, it is your responsibility to create awareness of all our employees, what is good for them. Make it a budget. That's more important. So what we need is, then again, if you look into that, prevention is the other one important factor. There are two killers for a woman. As I mentioned before, that the woman is the nucleus of the family. When she is the most negligent person in the family as far as health is concerned, if the kids are having some problem, immediately they take them to the doctor. If the husband has a problem, they will go. But if it comes to her, she keeps on postponing it till it gets very, very late stage. There are two important killers for the woman cancer. One is the breast cancer, another one is the cervical cancer in the world. Both are very, very easily preventable or identified in the early stages. The one important thing you need to do is, on a weekly basis, you palpate your left breast with the right hand your left hand with your right breast. Every week, if you palpate, if there is any change, then you need to go for a mammogram. It is an easy thing, can able to identify. The other important thing is the cervical cancer. Yearly once, if you go for a pap smear, which costs about 600 to 700 rupees, you can able to identify the cervical cancer in the early stages. When you identify these two cancers, the cost will be very, very minimal. If you identify these things in the late stage, then you have to collapse. Entire family has to collapse because there is no other person in the family to run. So you are neglecting yourself. So health awareness has to be a very, very important aspect for the family. How we need to prevent. It is not just like going for executive health checkups doesn't give you anything. If I see the executive health checkups, 70% of them are men. Only 30% will be the women. But because they neglect. The other important thing what we need is, when you keep doing all those things, thought to the family, the prevention, the health. As we are mentioning about, if you take more calories, what will happen? You become obese. The one important thing, if you can eat anything what you like, the number of calories you eat, same day you have to burn the number of calories, then your health will be perfect. There is nothing like it. Whatever money you earn, if you don't spend during your lifetime, who will get spoiled? Your kids get spoiled. Here your calories will burn you, where your money will burn your kids. So if we are able to keep all those things, talking about health, because to empower to all our employees, one important thing, cup of coffee is the easiest thing. You people should be able to empower, even though they have the insurance. There are some people who are less than 15, 20,000, they go for ESI, but they won't get treatment. They will come here. The accessibility is there, but they will also suffer. So the one you need to put into the minds of all our employees is, health insurance is a money-making area. It's not a spending area. If you get a disease, you spend money. How you spend? Like what I've been exercised you before. If you get a disease, you are going to spend 20-25 lakhs in a single time, all your savings in your life. Suppose you would have been put only insurance every year, then your savings will not be there, and then you don't need to pay this 25 lakhs. That's how it is a money-making area. Health insurance is a money-making area rather than spending. If you don't do insurance, you are going to spend your 25 lakhs of your savings. Please put into the minds of all our employees. It is a money-making area. Unfortunately, we should not get diseases. The diseases will come only on two areas. One is your diet, nothing else. Second one is your comparison and expectations, your mental tension. These are the two things which are able to get the diseases. I will always keep saying that the diseases are bought. Unless you spend unnecessarily 25 to 30 lakhs, you will never get diseases. Whether in the form of junk food, whether in the form of smoking, whether in the form of drinking. I'm not saying you should not do all those things. It should be very limited things you should be able to do. Smoking, lack of exercise, all these things. So with this, I think you people being a insurance-based and a HR-based, please go and convey to them. And if there is something happen, always better. We created the hospitals as a multi-specialty hospitals. The reason is from skin to lung transplant we have to do. Unless you don't have, you don't get a quality care. So that's why we build a quality, affordable, accessible care. So one thing which I want to do is create an awareness how the diseases are going to come. Most of them can be preventable. Most of them can be identified in early stages. If you identify early stages, your expenditure will be very less. Not only expenditure, forget about it. Your entire body, health will get spoiled, crippled, and post-discharge you may not be as active as you are before that. Money gone, health gone, and then your quality of life is also gone. So keep all those things in, And I expect all of you should able to keep talking to your employees because you are from HR based, and we keep telling, we sending all the letters. If you have your emails, we keep sending. One email I send, for a kid, for the first 3 years of life, you should able to interact minimum of 3 million words. If you don't interact 3 million words, the brain will not able to develop as much as an intelligent guy has been developed. 3 million words, somebody has to keep talking to them. Today I am seeing, when we were there, 5 children or 4 children only my mother used to take care. Now the kid is there, there is 2 people will be carrying the child. All the time parties, if you come, 2 nannies will be there on either side. Then what you communicate, what you want to communicate to a kid, that's most important. I'm telling you, how many of you know or not, 3 million words in 3 years' time. If a kid gets for the age of day 1 to 3rd years, nearly 1,000 days, then the brain of everyone will able to improvise. Most of the diseases we get lack of vitamins. So you need to take all these vitamins that will able to help you to prevent lot more diseases. Nearly 27 cancers comes from lack of vitamins in the body. So I think with this, I will stop. What I want to create an awareness is accessibility. That means whenever there is anything, you are there, KIMS Hospital is there. Don't think I'm branding. Then affordability is the reason why I'm saying is our entire consultants is almost, they are only looking for the quality, innovations, change. One more thing we need to be change. Change is a fear in our body, or our mind, or our family. Shilpi did, because how the delivery is much, much easier. Otherwise, if the delivery means you have to lie down for 9 months. Today, just before delivery, you can dance, you can do anything that has been created. So unless you don't change innovative ways, you will never come into. You put a question why, what, and how, everything will settle down. So this, thank you very much, Shilpi, for giving me this opportunity.
Thank you very much, sir. Before we proceed to the question answer session, I request Dr. Nirmala Papalkar, consultant urogynecologist from KIMS Hospitals, to kindly share a few words with us.
A very warm good afternoon to one and all. It's a pleasure to be here. So, as has been spoken much about the women's health and well-being, there is one more aspect, that is the quality of life. We have so far been talking about treating diseases, and as has been highlighted so far by the eminent speakers, that prevention is what we look for. And another aspect is the quality of life. So, by the quality, what I mean to say is, after delivery, after the families are completed, mostly for the working women, there is something about the continence. That the continence is like related to control of your bladder and bowel. That is not having to lose urine while you are working, or the bladder driving you all along. So these are few aspects that are covered in another subspecialization of gynecology. That is what we call the urogynecology or female pelvic medicine. So in this, the prevention part starts from the antenatal period. Excuse me. So right from the first pregnancy, the antenatal programs which have been followed in the KIMS hospital during pregnancy and thereafter, those are the preventive measures which can prevent many problems in the later life, in the more important and productive phases of our life, that is after 25 till you are 60, 70 and even later. So it's not just the length of life, but the quality, that is what is important. And we have these services in a very scientific manner available in Secunderabad branch and in Gachibowli branch also. Before I leave this platform, I would only say that pay attention to the quality of life, and whatever small problems that you have, the embarrassing problems that you will not find convenient to discuss with, you can come forward and we have very simple solutions available for them. Thank you. Thank you, Dr. Shilpi. And congratulations for this program.
Now we will open up this time for Q&A. Any questions regarding anything? You can even ask questions to our CMD and also Madam Anitha, along with the doctors.
Yes, there is a new branch that is coming up in Begumpet. It's a 15-story building. Sir, maatladtaru.
Not a new branch. Recently, KIMS acquired Sunshine Hospital. The old Sunshine near the Paradise was a very, very old building. So it's difficult to renovate also. That's why we got a Begumpet one new building. In that, I think we are going to shift in the next couple of months. The same old Sunshine there.
Definitely, early puberty has an impact on overall life. It means your body is exposed to early hormones, and that can have a overall effect in the future also. But preventive strategies are very well there in terms of taking care of the pediatric population. That's just generally the pediatric population. Physical exercise, something that every parent is lacking. There should be an initiative to inculcate sports and make sure that the children are mobile, they're walking, they're free of gadgets, they are enjoying their childhood like what you enjoyed your childhood. And it's more so important that they should not be stationed at a single place like couch potatoes. So basically, when there is a lot of stagnation in terms of less activity, exposure to more junk food, exposure to higher fat levels in the body, and some items that have pro-estrogenic effect also, there is an incidence of premature puberty. And since premature puberty is now a burning concept, it has to be pretty much taken care of, and there are specialists available in the hospital. There is a team of pediatrician and endocrinologists together working on this concept and how to strategically prevent such problems. And even if anybody lands into that problem, how to delay the problem is there, and you can avail their services.
Thank you so much. Hello, a very happy afternoon. And it's nostalgic that she's my gyne, and I have come to her as expecting mother, and I never expected I would shoot this question. And I actually am Rupa Shri. I work for Google as a flow manager. Just introducing myself here. And I want to address about the teen pregnancy. I think not many will like this question. But when I went abroad, and a place like Uganda, I have come across this. And when it is teen pregnancy, they themselves don't know where to go, what to do, and they might go a wrong way, or they don't even confront to their own parents. So do we have any solution for that?
Just in that you mentioned Uganda, but there are several teen pregnancies, more than India we have in US and UK. There are several young women out there, young maybe children to adolescents out there who are prematurely exposed to the environment and have sexual activity, because of which before they know about contraception and contraceptive benefits and the options of contraception available, they themselves become pregnant. So it is a thing that has to be incorporated into the education system. And unlike India, other countries, the access to doctor is very limited. In India, we have a doctor, a lady doctor available easily in couple of kilometers. Even in the rural areas, you have one or the other specialist or one or the other doctor available to address this problem. But globally, it's not that situation. Doctors are available lesser, and that's where the need of educational system incorporating the subject and to teach contraception way more important than sexual education also. Sexual education is one thing that has to be concentrated, and when they are identifying their bodies and they are exposing themselves to this kind of problems, even contraception has to be a mainline thing that has to be educated. And when you empower young adolescents in the right subjects, definitely problems like teenage pregnancies can be addressed. And now that the government has announced that the marriage age is not 18 and it's 21, so might be we're going to have lesser teenage pregnancies in future. It would be more of accidental pregnancies and pregnancies with lack of information and guidance. But otherwise, if educational system incorporates this subject into main school education, then definitely we will not be landing into surprises.
Thank you. Thanks so much.
Namaste. My question is to Bhaskar Rao Garu. I'm Dr. Andala Misati. I have not exactly a question. I have a feedback, one suggestion, and one request too. The first one is regarding feedback. I have got a surgery last year, February, from KIMS for my gallstones thing. There were so many people who told that better not get it done because it will have its own complications, but I have got it done through KIMS. Dr. Vijay Garu has performed it, and within 10 days I started eating my biryanis and everything, and I'm quite fine till date, and I have no issues, complications. While I was there in the hospital for 2 days, I was thinking about the same thing that as you have been saying, this has been becoming more and more costly affair because people's expectations are so high that you have to be doing so many things that hence you have to be charging. Because during that time I have taken quotations I'm saying from different hospitals. One hospital has given me 90,000, and from KIMS I had to pay some 2.2 lakh. As you said, I didn't foregone my coffee, but I had my insurance with Manipal Cigna, so I could afford that 2.2 lakh thing. I agree that people have been having too much of expectations from the hospitals, hence they have been going for smallest things like cold, fever also. One thing is, I congratulate you, the kind of hospital maintenance that you have and the doctors that you have and the successful treatments that you have been having. But my suggestion here is, can we have something like that, a franchise kind of a thing? Because people have been doing their medicine education ke baad, if they are not with big brands, they are not getting their customer, clientele, patients I'm talking about. If you have a green curtain, people are not ready to go there. They're okay with, for a small fever also, spend some 500 bucks and then 5,000 rupees for tests and everything. Can KIMS, like kind of hospitals, think of having small clinics instead of for every small thing going to a big specialty hospital? Can we have something like that? Maybe you must be having, I don't know whether I'm a right person to give this kind of a suggestion, but this is there in my mind. Not that everybody can afford to go to that specialty hospitals. Why not think about those things? One. The second thing is, I was teaching patient experience management, and I felt that hospitality industry mein customer experience management is something which is very important, and here patient experience management is also very, very important. Agar thoda bahut idhar udhar gaya to people start talking so much ill nonsense about the hospital, including a nurse. Agar kuch galat kiya to bhi everything goes on to the hospital and this thing. patient experience management. I do want to write a book if you can give me an opportunity. Thank you so much.
Thank you very much for asking this question. Because it was getting late, many people are waiting for the lines. I can also tell so many things on the. See, the culprit is the patient. I'll tell you the reason. Usually, the patients dictate what should be done. Usually, a good organization, a good hospital, unless you diagnose the entire disease process and how it has come, you should not start any treatment. Today, patients are coming, my fever is there or not too, we have to start something, you give antibiotics. 70% of the antibiotics we are using is useless, as waste also. It is not required also. Because the pressure by the patients, they come back and say, I am a headache. Something we write it down. And then they say, why don't you write this CT scan? If I don't, they'll go and get it done from the next door and come back next day with me. So the importance, unless you people don't understand, trust the doctors, that relationship has gone. Today is entirely on a medical legal side we are doing. Is a defensive medicine rather than a qualitative medicine. The moment when you go out of the defensive medicine, the cost will come drastically down. We don't need to do unnecessary things. Today, there are people who comes to the real corporate hospital like KIMS. They might have visited 2, 3 or more than 5, 6 people for the same disease. And basically what they do is they don't even investigate, they put the treatment and come back, and the last stage only they will come. If you follow your family doctor methodology, and whatever it is there, if you go there, your expenditure will come down 50% of it. There is no second opinion on that. So, thanks for all the good words. Should go to all my Kondapur doctors and Sudhir and Naidu who has been done that. The other session of the franchise, we also has been allowing this idea of doing that. There is a big problem in that franchise. Today, to retain and continue the quality care, we need to put a lot of people on the job. Suppose if I give franchise, if they don't follow the systems, policies, the materials, the things that what we want to do it, tomorrow something goes there, they will only show the Secunderabad, the media will show only the Secunderabad building. KIMS has been done, this KIMS has been done. So the reputation and the risk management is more important than giving franchise and all those things. The only thing is what we need, it is not the government fault. I am giving an example. It is the fault of the voters. If you elect proper government, they will do good job. If you go to the same thing, if you are able to listen to the doctors, then automatically things will be able to move. As you rightly pointed out, there are small complaints. If the patient wants to pass urine, there will be 2, 3 people are there. They don't even give the urinals. They keep on pestering the sister, the ward boy, come. Your own kith and kin. You don't want to help. Even they may be busy somewhere. They will come back and they write a big Google note. This is the rubbish hospital. Don't go there and all. That is another. I have to put some other person. See, whatever you people are complaining, I have to put so many people. Again, who is paying all these things? It is you people are paying. It is not mine. Okay? Anything. So if you people are able to understand, that is where whenever we go there, understanding is the most important thing. Like that, we want to do a good quality provided if the patients understand. So, suppose I put 14 lifts in my Secunderabad. Every patient complains the lifts are insufficient. We put only hardly 400, 500 beds. For every patient, there will be 10 people will come every day. God only knows why they are coming. I have been in America, I have been in Australia. Hardly any visitor will come. Maximum they will send some bouquet to someone else. They don't even come to the room. They will leave it in the reception. So here the number of people, we thought only 400 people, okay, 12 lifts are more than enough. If there is 1200 people are coming, it is very impossible. Thank you very much, but the franchise it has its own advantages, it also has its own risks. Have you satisfied with your sex education? Hmm? Okay. But I am not a psychologist. I will give you something. Sex has three portions. Anybody knows? See, there is a pre-intercourse, intercourse, and post-intercourse. Unless you enjoy all these three, sex will never be enjoyable. People will go with lust. Nobody knows what exactly sex is going to create. It is the lust which is going to kill you, it is going to separate you, it is going to, because all the people, unless, especially the woman, is not so geared up like a man. Men mostly go with lust. The woman will come with love and affection. The pre-intercourse, unless you both them do that, the sex will not be enjoyable. So the most of the things we cannot able to tell these things. Why I got it, so many people who've been divorced, I keep on talking and explaining to them what are the problems, all those things. So when you want to teach our kids these three important aspects, you need to teach them, most of the things will be resolved.
Excuse me, sir. Myself, I'm Sridevi. I represent CloudGen as an HR. My question is about the mental health awareness. So, in my company, I see many of the women employees, or it can be men. I see like that a lot of challenges which they are going through in terms of mentally, the kind of abuse which they are facing outside the society, which will actually lead to a person for physically actually. I mean, instead, like the person, if they are not able to accept themselves mentally, if their person is not mentally fit, they cannot be physically fit also. So, can I know? Can you please tell me few things about the mental health awareness as well?
See, basically, as I said in the three aspects of sex, what's happening? Even one of my independent director also called me, how come in last 20 years you don't have any POSH, any sexual harassment committees or no harassment? See, basically, when you are able to understand, the people who go with the lust, all these problems will come. The people who understand the love, affection, and understand each other, irrespective of the partner, they agree, they go with that. They will never complain. They need to understand each other, whether it is extramarital or during their own life. The moment when you are able to understand the sex properly, most of these things will be disappeared from the organization, whether from men or from women. It will be there from both sides. It is a mind that is able to create the sex with the hormones. The lust will start there. The moment when you are able to understand, even during the colleagues they never able to bother rest of the things when they want to really enjoy the sex. The entire pre-intercourse sex is not that just under 15 minutes before that. It is during the journey. How in the family itself, wife and husband go together, day in and day out. If you are able to watch that, most of the life, most of the families will not get into problems. Most of these youngsters, they all keep roaming around, but they don't ever talk about it. That's why they keep on coming to the urologist and the gynecologist and other things. I don't know whether I answered your question.
And mental health issues per se have a lot of deeper insight. Basically, men or women, if they have any unrealistic expectations out of themselves or out of others, then we're not able to meet up to the expectations. They have these mental health issues. Whether it is about workplace or home or a personal space that they have, if they're not able to solve their problems by seeking help, if it is family problems that are disturbing them, they have to talk in the family. If there is a health problem that they are suffering and they are having health issues and mentally affecting them, they have to talk to the doctor. Or if it is a workplace where they are having any kind of a harassment or any kind of pressure or untoward expectations towards their work and their work expectations, they have to have some people dedicated who can address to their issues. So it is always a point in time that whenever anybody has a mental health problem, there are help available everywhere, whether it is a doctor or a psychologist or somebody at home or at office, or if you yourself are suffering with any health problem, then the doctor.
So 70% of women, like, they won't come forward and say what they are actually going through. It can be a physical abuse, I say, trauma, I
Yes.
would say, or in the work culture, the kind of for the career development, any kind of a pressure it could be. So if they are not able to accept themselves, if they come out from the house and they are not able to accept themselves in terms of mentally, yes, I will be doing these things. I have to take care of my health. I have to take care of my family. So there are like, what I have noticed, out of 70% women, they won't come forward and say what they are actually going through. Might be the insecurity feeling, what if I say, what exactly the circumstance actually I need to face. For this, like, they are, I know like many of the companies are doing the sessions for
Yes.
the mental health awareness also, but I still feel there would be a lot of sessions should happen in terms of
Yes.
mental health awareness actually.
Yes. And about mental health awareness, it's a vicious cycle. If a young child is not given an opportunity to talk and express, if an adolescent is not given the direction of expressing his or her views on a topic or on his bodily changes or anything, that again as a teenager will go forward in a suppression, and as a young person who's just got a job will not be vocal. So where it should come from is from the perspective where we should encourage our children to talk and to say and to express and to find their own solutions. If such a verbal communication is encouraged, then the future will see lesser of these problems. Every hospital, concentrates more on physical illnesses, but we at Cuddles, as a mother and child center, identified this concept of mental wellness. That's why we have several sessions, whether women are attending, not attending, pregnant women are coming, not coming. Relentlessly, we work on engaging their thoughts in the right direction, giving their energy a right path, the path that defines happiness, and the path that defines that you should be at any given point happy in your life with whatever that you have. Whether pregnant or not pregnant, the chemistry between the partners should be there on a single agenda. Both of you should together work on it. Whether it is a painting session, knitting session, whether it is a session on wellness or water yoga, or whether it is a session on massage, anything, we engage couples together to come forward, spend some time with each other, build their chemistry, talk to each other, engage with each other, and make sure that you don't suffer in silence. Suffering in silence is the most worst thing that anybody can get impacted. So that's why we used to have exclusive Saturday sessions on that, and Sunday yoga. Sunday yoga again, Sunday morning, 8 to 10 o'clock. All couples come, irrespective of which area, which class, and nothing. It's free for everybody. Whether booked with us, not booked with us, whether a neighbor or whether coming from 400 kilometers, it's irrespective. They come together, they engage themselves, they engage in couple yoga, do some exercises together, talk to each other, form a community, form a group of people with same situation, where they talk amongst themselves, get solutions among themselves. So this culture we have developed, wherein if there is an issue, I need not address to that issue. I'm there in that group. The groups are about 800 people, 900 people in a group, antenatal group and postnatal group, where anybody has an issue, they just type their issue, and there are several like-minded people having the same issues. How they solve that issue, they immediately pop up within a frame of half an hour. 10 solutions are there. I comprehend, read all of them, and give my note again. This happens everywhere. This is what you have to do. That single word of accessibility and a forum or like-minded people together solve hundreds of problems, and major problems get their solutions in such platforms. So it's all about living together, enjoying your journey together, staying happy together, whether it is from spouse or friends or children or elders or workplace. It's all about your energy. If your energy is positive, you give the same energy to everybody around you, and it comes back. It comes back. Somehow I feel that when I started Cuddles, and 7 years down the lane, almost all our faces are looking same. My face, my juniors, my assistants, all. Why? Because there is a single thing that connects us common, our smile. Everybody has a smile on their face. Everybody is so positive. Anything happens, we'll look at it later. Now we're going to be happy. So that happiness culture you should develop. When happiness enters into you, there is no secondary thought, there is no negativity, there is no abuse, there is no, there's no problem at all. Because when you want to preserve that happiness, you talk, you engage, you solve, you change the world you live in. So that's why it's all about communication. It's all about being you yourself, a positive person, and your energies should be positive so that everybody around you will be according to you. If you are a negative person, if you are shouting and yelling at people, nobody will be happy, and all these mental illnesses will be there, and the negative environment will be there. One positive person, one person smiling, one person talking good, one person with good energy can change the world. So that person should be you, and that place of work should be your place.
Hi, ma'am. This is Vasudha, and I work for Amazon. I'm representing Amazon here. Firstly, congratulations for this such a great initiative, and I'm honored to be here in the presence of such delegates and strong women and supportive men all around today. My question is, so majority of the people here today are from HR background or working for corporates, basically. So since that we are into corporates and we are having that awareness programs going around, and the mouth publicity going around, probably in the offices or around the people whom we are in the network, we are able to know about these programs going, and we could able to attend these sessions and get more awareness about such things. But is there any initiative that KIMS is specifically taking for below poverty line people, or the women who are uneducated or unemployed, or who do not have access for any of these mediums to get a hold of this amazing awareness programs going around? So is there any such initiatives going on? And if there are any, I'm sorry.
Yeah, definitely. There are a lot of initiatives. Every consultant of KIMS has an access to the social media, and we have regular programs and initiatives that the organization takes, and they deliver it to every sector and every phase. I'll tell you one point. I started doing these videos and empowering things and all these things quite some time back. Maybe around 15, 16 years back, I've been very vocal about these things. But now that social media is available to everybody, YouTube is available to everybody, everybody has a GeoSIM, every small farmer has a phone, and they are watching us, and they are listening to what we deliver. In a similar way, like me, we have a team of doctors, hundreds of doctors, who every month do series of videos, educational videos, empowering videos, and all these are free of cost, and they are there. Anybody with a problem, just a minute in time, if they can type and check that in any language, and it is not a barrier that we do only in English or Telugu. There are several other languages that we cater to, and now that access is there, I'm not talking about crowd that access Instagram and Facebook. I'm also talking about crowd, that the village crowd that even access YouTube. I have seen small villages, small farmers coming with the symptoms and signs that I have told, and getting checked up and getting the problems solved with one video that I made. Maybe that was a very casual video on a routine basis that I made, but that hit that person, and that person, when spoke to his wife, she told these complaints and he brought her to me. That person happened to be the right next, the farm that I owned, the next farm is his, but he didn't know that I was owning that farm. I asked, where do you go? What do you do? So this is what social media is now. Every information is accessible. Every positive thing that you can do is available. And we do a program called Mrs. Mom for all pregnant couples every year, annually. It's free and it's empowering to them. And we teach them about right parenting, right pregnancy aspects, and how the future is there. We also have an initiative of promoting foods that are sustainable and also a life that is sustainable. We also promote concepts like eat seasonal, eat traditional, and eat local foods that promote health and wellness. So it's never about the disease that we talk. We also have a very focused approach towards prevention strategies, and every prevention strategy is available in the platter to even uneducated people. But the choice has to come from internal. The choice is human. They themselves have to evolve to a person that they want to change and they want to know about their health, they want to access to healthcare, then there is no limit.
To add a little bit to what Shilpi is saying, we do a lot of things. If you look into that, we call a lot more times these ASHA workers, who are the ground workers for healthcare, employed by the government of India. And we call them, we'll explain. That's what Hon'ble Governor was telling about breast awareness. If you see in the month of October, the entire city of Telangana, whether it may be Charminar, whether it may be Secretariat, even the Governor's Bangla, and all will be illuminated with the pink. So if you look into being an HR, if you look into our financials, this is the only company, KIMS, which does 10 to 11,000 RPOPs, which no other healthcare is providing. 70% will do that. 30% of our entire population is below poverty line. Because we created this Arogyasri scheme, and then even 10,000 rupees, most of the companies do around 30,000, 40,000, 50,000. So our average is around 29,000, where we also do top end, we also do the lower middle class. So we are more all catering for the entire nook and corner of the Telugu states. That's why we stay focused for last 2 decades in this country to provide healthcare to each and every person. It's not that we should only treat that. We are not for money. The amount of money what we spend here, the amount of manpower of all the 20,000 employees spend, if we put in the real estate, we don't, for next 10 generations, we don't need any income. We do a lot more.
Thank you.
Let's all have a small closing session and small mementos for all the speakers. They've taken their Sunday afternoon time out, and I'm elated to have all of you all here. And this business, this Women's Health Conclave actually started with one discussion between me and my the person who heads the business wing of KIMS, promoting healthcare in corporates and all, that Naresh Durga. I was going home and he called me and he said, Madam, meerantaru pregnant women ki anni cheste maakem untadi ante. I asked him, what do you want, Naresh? Then he told, Madam, something for the corporates and insurance companies we should do. Then I told him, KIMS is doing such a great thing, and Madam, kana andarki teliyadu kada. Then I said, okay. Now we're going to do a business, not only for business, we'll do something very much oriented for women's health. And that was the origin of Women's Health Conclave that just emerged a month and a half back. Then strategically we thought whom all to empower so that they'll be the source of inspiration for their companies. And then we enhanced that concept, and then we started to talk about the speakers and what to talk and how to generate. Then I called the governor. She was in Tirumala, and then she took my phone and said, what, Shilpi, what do you want? And I said, Madam, there's a event that I'm planning, which is a health conclave for women, and we are going to get such and such a people from so many places. And she told this is a good initiative, and she herself told that she will come for the initiative. From there began this small initiative, and definitely we will keep up, and we will keep increasing what interaction what we can do in future also.
We'd like to present small mementos to our dignitaries on the dais. Ma'am,